Hello again, everyone. So these are the Chapter 10 key points. We are going to start out with identifying two ways that Medicaid programs vary from state to state. So we listed here that states authorize additional services or groups eligible for coverage under their own Medicaid program. And then the states are going to determine the eligibility within those federal guidelines. So a couple of things to note here. Medicaid is a service that pays for healthcare services for people with incomes below the national poverty level. Both federal and state governments pay for the program, and in some areas, local taxes also support the Medicaid program. The federal government makes payments to states under something called the Federal Medicaid Assistance Percentage. And that's the amount, or the amount of that payment is based on the state's average per capita income in relation to national income average. States that have a higher per capita income are going to receive less funding than will the states that have lower per capita incomes. Each state, Medicaid is administered by a fiscal agent, which is an organization that processes claims for a government program. So the Center for Medicaid and State Operations is a department of the Centers for Medicare and Medicaid Services, or the CMS, as we call it for short, and that's who oversees the programs that are administered by the states. So just a few things to note there. Okay, so comparing the Medicaid benefits that are determined by federal and state laws, there's something called Early and Periodic Screening, Diagnosis, and Treatment, which is EPSDT, and that's a prevention, early detection, and treatment program for children under age 20 enrolled in Medicaid. I'm sorry, under age 21 enrolled in Medicaid. There's CHIP, and that is a state program that is aimed to provide health insurance coverage to uninsured children. And then there's also the Ticket to Work and Work Incentives Improvement Act, and that gives states the option to allow persons with disabilities to purchase Medicaid coverage and maintain employment. So a few things there. CHIP, I just want to note, there are more than 5 million children that are served by the CHIP program, and they all come from low-income families whose incomes are not quite low enough to qualify for Medicaid. So they probably have to pay a premium to get onto this CHIP program. That CHIP program is funded jointly by the federal government and the states, and it provides coverage for many preventative services, and it covers kids up to age 19. So the EPSDT covers up to 21, CHIP covers up to 19. So the state portion of a Medicaid program often will include a number of additional services, and that falls under the federally funded Medicaid program. In recent years, though, there have been a large amount of state budget deficits, and so the state laws have cut back on some of these benefits. For example, some prescription drug benefits and hearing screening, vision screening, and prescriptions for eyewear. Dental benefits for adults have also been cut. And many states have also restricted eligibility for Medicaid to reduce Medicaid payments to doctors, hospitals, nursing homes, and other providers. So just some things to remember there. There are two broad classifications of people who are eligible for Medicaid assistance. One group of Medicaid recipients is known as categorically needy, and their needs are addressed under the Personal Responsibility and Work Opportunity Reconciliation Act of 1996. It's more commonly known as the Welfare Reform Act, which created TANF, which is Temporary Assistance for Needy Families. So the eligibility for TANF is determined at the county level. It's not necessarily determined at a state level. And this program helps with living as opposed to medical expenses. So it provides cash assistance to needy people and as well as food assistance, so food stamps. Some states extend Medicaid eligibility to include another group of people classified as medically needy or medically indigent. And so these individuals earn enough money to pay for basic living expenses like food and their utilities and things, but they cannot afford high medical bills. So in some cases, Medicaid recipients in the medically needy classification have to pay deductibles before they'll receive benefits. Some Medicaid recipients in this category must also pay co-insurance for medical services. So each state has its own version of these categorically needy programs and medically needy programs. For example, and each state chooses its own name for the program. So, for example, California is Medi-Cal. I'm from Indiana. Indiana was Hoosier Healthwise. So each state has a different name for the same type of program. All right, let's move over to the next point. So we want to look at factors that require special attention when filing Medicaid claims. Patient eligibility is always a big deal, and Medicaid identification cards always need to be verified. So we're always going to make sure that they are eligible and still receiving Medicaid services. Because Medicaid is income-based, that can change from month to month. Okay, so we always want to make sure that we check the patient's Medicaid identification card or their coupon and photocopy the front and back of it at each visit. And then we want to date the photocopy. So some states require this photocopy to be attached in order to submit the claim form. An example of a Medicaid card is shown in figure 10.2 in your textbook if you want to check that out. Pre-authorization also must be obtained for specific services. Most states require pre-authorization for specified service. So there's a very specific set of services that have to have prior auths done. You want to check with the state's fiscal agent to find out how to get pre-authorization by telephone and whether a written confirmation form must also be filed. If the state requires pre-authorization, then charges for services that did not get prior approval will not be paid. In emergencies, such as emergency room situations, authorization may be obtained after the treatment, so they can go back and make that authorization retroactive. Filing deadline is something else you need to be aware of. The timeline for filing a Medicaid claim ranges from 2 months to 1 year from the date of service. You want to find out about the state's requirements and make sure that those claims are filed promptly so that we can get paid on them. And then lastly, third-party liability is the obligation of a government program or insurance plan to pay all or part of a patient's medical costs. Before filing a claim with Medicaid, it's super important to determine whether the patient has other insurance coverage, because if they do, we're going to bill them first and then bill Medicaid as secondary. Okay, so those are your Chapter 10 key points. You want to make sure that you complete those CMS 1500 forms for Medicaid in your Connect software for Chapter 10.